Hi, my name is Chris. I'm going to be the nurse during your head-to-toe assessment today. What is your name?
It's Amanda.
Mandy, where are you today?
I am at Blunt Memorial Hospital.
And what month is it?
It is April.
Okay. Can you tell me your age?
I am 36.
All right. So the patient is alert and oriented ×3. Feels appropriately dressed for the warm weather. Is pleasant demeanor, well nourished. We took vital signs before we started this interview. Blood pressure was 140/80. Pulse was 85. Temp was 98.5, and respirations were 20. Patient's height is 5'9", weight is 180, and BMI is 26.6. Mandy, since we're already standing, I'm going to ask you to please walk from the edge of the bed back to the wall and back. I'm just going to watch your gait.
Okay.
Very good. And then this time when you do it, if you do tandem gait, which is heel to toe.
Okay.
Thank you, Mandy.
Welcome.
Gait is well coordinated and stable. So we're going to do some cerebellar function tests now. If you could just close your eyes, and I'm going to watch for any swaying, which is normal to have some slight swaying. Thank you. And the Romberg test, if you could put your arms out, palms up. And I'm going to watch for any drift downward, which I don't see any. That's the pronator drift test. Also, if you could bend over, I'm going to check your spine. The alignment, spine is center, no curvature noted. Thank you. No scoliosis, no kyphosis or lordosis noted. Maybe if you'd like to have a seat now. I'm going to have a look at your skin. Your skin is pink and soft and warm, and I do see some freckles here or there, especially on your shoulders. There's a tattoo on your left foot and also on the back, upper back. Your skin trigger is intact and brisk. Your nail beds are pink with capillary refill is brisk, less than 3 seconds. Your hair is fine and well distributed. Your face and your head is normocephalic and it's midline over your shoulders. Your facial features are symmetrical. I'm going to have a look at your eyes, nose, and mouth and ears. So for your eyes, they are symmetrical. There's no lid drooping, no ptosis noted. Your conjunctiva is pink, and your sclera is clear, white, translucent. It's no drainage or irritation noted. So I'm going to test your cranial nerve 1, the optic nerve, which you would do with a Snellen chart or reading fine print. So if you could read the first line of fine print there.
Alternating hand movements.
Thank you. Alrighty. I would also test for the cranial nerve 2, which is the ocular motor nerve, Perla. I'm sorry, cranial nerve 3 is the ocular motor Perla. I'm going to shine a light in your eyes. Look at your pupils. Okay. Your pupils measure about 3 millimeters. They are equal, round, and reactive to light. If you could follow this pen line in, and they're accommodating as well. I'm going to check cranial nerve 4, trochlear, and 6, abducens. It's the cardinal 6 stages of cardinal gaze. 1, 2, 3. Okay, and those are intact. I'm going to have a look at your nose. It's midline. Nasal mucosa is pink and moist. I do note that your septum is deviated slightly to the left. I'm going to check for patency. Okay, both nerves are patent. The cranial nerve 1 is the olfactory nerve. And by report, do you have any issues with smell?
No.
Okay. I'm going to have a look at your mouth. Your lips are pink and moist. And I'm going to look inside now. Your tongue is midline, your uvula is midline, your gums are pink, moist, no bleeding or inflammation. Teeth don't have any caries. I'm going to test a few cranial nerves with your mouth. Cranial nerve 9 is the glossopharyngeal. So by report, do you have any problems with taste or gag reflex?
No.
Okay. Cranial nerve 10 is the vagus nerve. I'm going to depress your tongue, and if you would say ah, please. Okay, the uvula is symmetrical, and it rises and falls symmetrically. And do you have any problems with hoarseness or swallowing?
No.
Okay. Cranial nerve 12 is the hypoglossal nerve. If you could stick out your tongue and move it side to side for me. Very good. Okay, I'm going to have a look at your ears. They are well formed, equal. They line up good with your eyes. Can you tell me if you feel any pain when I palpate the tragus?
No.
Okay, and there's no drainage noted. I'm going to test cranial nerve 8, the acoustic nerve. If you could cover your ear with your hand and repeat after me the words I say. 1, 2, 3. 1, 7, 5. Okay. And then on the other ear, red, black, white.
Red, black, white.
Okay. So another cranial nerve is the trigeminal nerve, number 5, and this is sensation. So I'm going to have a soft touch and a sharp touch. And if you could tell me which do you feel when you close your eyes for me.
Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Sharp.
Very good. Okay. Cranial nerve 7 is the facial nerve. So if you could raise your eyebrows for me. Okay, squeeze your eyes shut. Smile. Frown. Puff out your cheeks. Great. Thank you. All right. So I'm going to look at your neck. Your trachea is midline. I'm going to feel your carotid pulses. They are equal bilaterally at 2. I'm going to listen to the carotid pulse for bruit, which I do not hear. I'm going to feel your thyroid, and I actually do feel your thyroid. It's palpable, smooth. Is it tender at all?
No.
Okay. I'm going to check cranial nerve 11, which is the spinal accessory nerve. So if you could push against my palms. There you go. Okay, against. Very good. I'm going to feel your lymph nodes. So we're going to begin with the preocular, the posterior ocular, submandibular, submental, anterior cervical, posterior cervical, occipital, and the supraclavicular, excuse me. I don't feel any lymph nodes. Do you have any tenderness?
No.
All right. We're going to do some cellular function tests. So if you can take your finger and touch your nose and then my finger a few times back and forth. There you go. Thank you. Other side. And alternating quickly hand movements. Good. And then heel to shin, down your leg. Very good. All right. I would test all of your joints for range of motion, and they would be equal upper and lower extremities bilaterally equal. But if you could hold my fingers and with your hands squeeze, and I'm going to try to pull away and you stop me. Very good. And your feet push against my hand. All right, good. So your muscle strength is 5 out of 5. I'm going to test your deep tendon reflexes. And I would do this bilaterally. I would start with your brachial, your tricep, brachioradialis, patellar, and your Achilles. Okay, and that would be both sides of your body I would do, and it was average, normal, 2+ reflexes. Okay, I'm going to assess your respiratory system. I would observe your breath, full breath cycle, listen for 30 seconds, so assess for 30 seconds. Your breaths don't appear labored or in any kind of distress, no nasal flaring, no retractions. I'm going to listen in a pattern to your anterior lung sounds, the apex, and the bases. And also, I would listen to the posterior sounds in a pattern. Okay. And the right middle lobe. Okay. The breath sounds are equal, anterior, posterior, and bilaterally. No adventitious sounds, no wheezing, crackles, or bronchi noted. I'm going to assess your heart now. I'm going to listen to your heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. The S1 and S2 sounds, I can hear them both. I don't notice or I don't hear any murmurs or gallops or extra sounds there. So I would feel, also when I listened to the PMI, I didn't hear any thrills or lifts. So if you'd like to lay down now. And I would assess when I do listen to the apical, I would assess for a full minute. And also doing it laying down and on the left side, you can listen to the PMI that way as well. All right. So as I lift up your shirt, I don't see any pulsations in the PMI or in the aorta. The abdomen's flat. It has some scarring, surgical scars in from childbirth. The aorta, I don't hear any bruise there. I'm going to listen to all 4 quadrants as well on your abdomen. Okay, bowel sounds are normal and active. I'm going to palpate. Let me know if you feel any tenderness in all 4 quadrants. All right, and I would percuss in all 4, listening for dullness or tympany. The bladder, I would palpate. I don't feel it. Any tenderness there? All right, and I'm going to feel the liver, the costal margin lifting up on the right side of the patient's back. I don't feel the liver. Is it tender? Okay, I'm going to assess your pulses, bilateral, the radial, brachial, femoral, and the pedal pulses. And they are equal, upper and lower bilaterally, 2+. Mandy, one last thing, I'm going to check for tenderness in your kidneys, if you don't mind just to sit up. Also, I don't note any swelling or edema in any of your extremities, which is good. Tell me if you feel any tenderness. No. Okay. All right, and that concludes our assessment. Thank you.
Thank you.